Good morning once again. I'm Dr. Thomas Nechupadam from Nechupadam Dental at Cochin. I've been posting some Malayalam videos, and so many English people have been asking that we don't understand. We see your smile, we don't understand anything. So please put in some English videos. So today we are going to do some English videos, and today I am coming up with another topic on aesthetics. Basically, a lot of people are worried about a space between the teeth, and if there is a lot of space between the teeth, and if you are not smiling, you should come down to Cochin wherever you are, and you can have a teeth aligned well, and there are different types of ways to close the gaps. So you might be wondering what is Dr. Thomas telling? I'm sitting in Australia, I'm sitting in US, I'm sitting in UK. What are you telling, doctor? It is not possible for me to come down to your Cochin every day to put braces on. Yes, braces are one of the treatments, but we have also aligners. We have some quick treatments like nanoceramic veneers. You have ceramic veneers. We have a lot of things which can make the teeth without gap and give you a good smile. So there are different types of this thing. So we'll quickly look into some of the merits, some of the demerits, and things like that in this video. So please subscribe me once again, and we'll give you some tips and tricks about dentistry, and also give you some treatment modalities for your great smile and great teeth. So first, what we'll talk about is how to do it in one day, or in 30 minutes or 40 minutes of treatment time. So one is to use a nanoceramic veneers, that is a chairside veneer, which can be used. Before we used to use composites, now we have nanoceramic materials, which is nanotechnology materials, which is much more smoother, much more biomimetic. Or why biomimetic? It mimics the biological space. We have some materials which are tooth colored, some materials which are gingival colored, so we can actually close the space between the teeth in just 1 or 2 visits. So are you a candidate for that? If it is space between 3 millimeters or less, so you may be able to do it very well. If it is a larger space like 5 millimeters or something, in some cases we'll not be able to do because it adds to the bulk of the tooth. So if it is 3 or 4 millimeters, we are happy to do it. If it is more than 5, we will have to assess the case before we do. But still, if you can send me some photos of your mouth and your smile with the gap on as a video response, we will be able to assess and let you know. And if you don't want to know, you can actually put it onto my WhatsApp or something like that. Now, what is the next this thing? If you are not happy with the nanoceramic veneers, you want the tooth to move, you want the teeth to come back a little bit, then we can go for aligners. The aligners do perfectly well if you do if you have just spaces, because aligners are a very effective tool. We have Invisalign, we have other aligners which are a little more cheaper, but all these things will move the teeth closer. It can take your teeth a little back, and then we can close the space, and then we'll have to use something called as a permanent retainer, so that we can close the space effectively. Why does there are some cases we might need to remove some tissues, because if there is a pulling tissue just near your space, then we might have to remove it, and that also can be done in just a day. So most of the treatments, just even for aligners, we'll have to remove the tissue, and we can take the impression, and we can send the aligners directly to you, and you can use it for maybe 5 or 6 months, and then you'll be able to we will be able to close the space for you. You might have to go for retention protocols also with aligners. The oldest methods is actually to use a crown, or you can even use your normal orthodontics. But those people who are abroad and things like that, it will be difficult for you to continue and pursue the orthodontics by coming down here. But most people who are here in India can come in, and once in 3 months or once in a month, as you wish, to close the spaces and get it corrected. Somewhat we'll be able to do it. We have crowns also. You can use crowns to put this thing, but it is not very fair on our part to remove some teeth structure just to close the space. So I seldom use the crowns unless it is a periodontally weak condition or things like that, or if there is a lot of other factors like caries or some infection or something like that, or a root canal treated tooth or something like that, then we can surely use crowns also to close the space. So somehow, if there are so many spaces, some questions had come down saying that can we use an elastic or a rubber band to close the spaces. There is a lot of marketing happening in the tooth, but there you should be a little more cautious using all those things, because the bands can go into the gingiva. We have taken out one tooth recently because they bought a band from the internet, and he was using it and suddenly it disappeared. He thought that it just went out, but it didn't go out. Actually, it went inside the gums, and he had bleeding gums, and he came here and the bone was really removed, and bone had gone, and then we had to remove the tooth. So I don't recommend bands for closing the tooth unless and until it is guided by a dentist. So please don't do it. It can be used for 1 or 2 days, and then we can correct it, but that has to be monitored. In a periodontally weak cases or something like that, we can use it, but it is highly not recommended to be bought on the internet and used. So make sure that you do a proper evaluation under a dentist before a trained dentist who can do some cosmetic work before you get into all these things. So all the best. Have a great smile without gaps and things like that. You should be confident enough to smile. You should not put your arms before your teeth just because you have a space. You can always contact me. You can ask me some questions. You can post some photos. I can share my phone number on the video, and then or under as a comment I can send it across to you. You can always contact me there, and you can put WhatsApp photos and things like that, so that we can tell you what exactly can be done in your case. Thank you very much. Have a great smile. Have a great day.